Diabetes is an increasingly common disease that now affects more than 1 in 9 adults in Canada. It also is a lifelong problem, so people with diabetes have a lifelong set of behavioral and medication issues that they have to deal with. In order to deal with such a problem, a coherent clinical approach needs to be in place, and optimally one that utilizes the resources of a whole city or region or province. The diabetes program in Nova Scotia really saw this 20 years ago when they first realized that it was important to have a coherent, comprehensive approach to diabetes throughout the province, and that has been one of the fantastic things about the program.
From the initial medical director and from Peggy Dunbar, I learned about the disease. I learned about the situation we had in Nova Scotia, and I learned about how it was a disease that was becoming the new, I guess, tsunami of illness in Nova Scotia. And I also learned that if we didn't put some consistent standards in place and a consistency of addressing it, we would never have a chance of being able to solve the onset of diabetes.
I was administrator of the Institutions Division of the Department of Health when the idea came up, and it was presented by Dr. Ming Tang that we look at a provincial system to monitor the standards and make sure that we were trying to provide the best possible care to individuals with diabetes. So I think we had 32 diabetes centers at the time in the province, and everyone was doing something different, and everyone was doing what was right, but the people next door didn't understand what was important and correct and what the best evidence was. So there was a lot of similarities, but there was a lot of differences, and it was quite clear that having a provincial program with provincial standards would enhance the quality of the program.
We really appreciated being able to work collaboratively in partnership with the Diabetes Care Program to be able to increase awareness and education in other healthcare professionals. So working together collaboratively is always the way to get to more people, and we have been very fortunate to be able to work with the Diabetes Care Program, to be able to continue on our plight, so to speak, that, you know, to educate more people and to increase that awareness of feet and you know, keeping Canadians on our feet. That's the goal with the Victorian Order of Nurses across Canada, actually.
Lynn Harrigan, who's the medical advisor for the DCPNS, basically put us in contact with the DCPNS because they wanted to develop physical activity and exercise resources for diabetes educators as a best practice initiative for quality diabetes care. So they contacted us, and we developed what is now the Physical Activity and Exercise Toolkit to help diabetes educators counsel on physical activity and promote exercise within their practice.
One of the important features of the Diabetes Care Program in Nova Scotia is its support of a registry of information related to the care of people with diabetes across the province. That allows the program to ensure that there is more or less a uniform level of care provided, and to target areas where there may not be as good care in some areas versus another. That's an important tool to use.
The Diabetes Care Program registry that was developed some years ago here in Antigonish, we were one of the early people to enter our patients, our local population. And we have been able to use that registry to look at our own population outcomes. And in Antigonish, it has really helped us to work with our family physicians, to show them how they're doing with their diabetes care, and to work as a team together. It's improved some team building and approaches to care.
I believe the Diabetes Care Program of Nova Scotia is a wonderful model of centralized care and support. It has been a leader in creating standards for professional development, as well as consistency in communication amongst health professionals. It's a huge challenge, the mixed messages that exist in the community, both in the lay community as well as in the professional community, about type 2 diabetes. And the Diabetes Care Program of Nova Scotia have been leaders in a centralized program with very excellent communication tools and setting standards, as well as quality improvement programs that have affected the outcomes of people with diabetes in Nova Scotia.
The Diabetes Care Program is always on top of what's current. So if there are some new guidelines coming down from the Canadian Diabetes Association, for example, you can be sure that they will take those guidelines and spin them down into usable tools for us at the local level, which ultimately improves the care and attention that our people in our community with diabetes receive.
The relationship and the project and things that we've done with the DCPNS has really been an innovative, not only in Nova Scotia, but Atlantic Canada, and you know, at the forefront really of where exercise is in healthcare across Canada.
I would guess from being an initial chair, I'm proud to see that it's celebrating 20 years, and now as a current Deputy Minister of Health, it is great to be able to still support this program from a centralized position.
I think that Nova Scotia, and specifically the Diabetes Care Program in Nova Scotia, really should be congratulated for its tremendous efforts and its tremendous contributions. And I look forward to making the same type of comment 20 years from now at the 40th anniversary of the program.
Nova Scotia DCPNS, we're promoting excellence, 20 years of care for you, and getting better. DCPNS, we are here to do our best. Diabetes Care Program of Nova Scotia.